My name is Rose Kagawa. I'm an epidemiologist at the Violence Prevention Research Program at the University of California, Davis. And this study was done with collaborators here at UC Davis, at the Johns Hopkins Bloomberg School of Public Health, and the University of California, Berkeley School of Public Health. The objective of our study was to estimate the effect of the repeal of comprehensive background check policies in Indiana and Tennessee in 1998 on firearm homicide and suicide rates. Now, comprehensive background check policies are slightly different from the federal law, which requires a background check when somebody is buying a gun from a licensed dealer. But comprehensive background check policies extend that requirement to nearly all firearm transfers, including those between friends or acquaintances. We compared trends in firearm homicide and suicide rates in Indiana and Tennessee to a control group of states that had comprehensive background check policies during the entire study period, and estimated effects over the 10 years after repeal. Now, it's difficult to estimate what would have happened in Indiana and Tennessee to firearm homicide and suicide rates had they not repealed these comprehensive background check policies, and usually one state or a small group of states wouldn't be a good estimate of the counterfactual. So we used the synthetic control group method, which provides a weighted average of the control states that more closely mirrors the study states in the pre-intervention period. We did not find a change in firearm homicide or suicide rates in Indiana or Tennessee following the repeal of comprehensive background check policies relative to their synthetic controls. Now, it would be an oversimplification to state that comprehensive background check policies are ineffective based on these results. The background check systems can and have improved since the repeal occurred in both these states. In the 1990s, there were a lot of missing mental health and criminal history records, so that if somebody was part of a prohibited category and was actually prohibited from purchasing a firearm, they may have been able to buy one anyway. This study was subject to a number of limitations. One, it was done during a period of rapid change in firearm homicide rates, so that would make it more difficult to detect an effect if there truly was one. Also, there were only 11 states that had comprehensive background check policies during the entire study period and were able to contribute to the control group. One of the important conclusions that comes out of this study is the need for more research. We need to understand whether more recent versions of comprehensive background check policies are effective. And we also need to understand whether there are ways that we can change the design and implementation and enforcement of comprehensive background check policies that would make them more effective.